Leukocytes are discussed in this screencast. Information on leukocytes may be found in Chapter 10 of your textbook. This screencast was designed to help you achieve the following objectives: describe hematopoiesis, define leukopoiesis, explain the general characteristics and functions of leukocytes, define diapedesis, describe each of the 5 leukocytes, define leukopenia and leukocytosis and list their causes, and lastly, describe leukemia. The production of formed elements, or simply blood cell formation, is called hematopoiesis, and it occurs in the red bone marrow. All blood cells, including megakaryocytes, arise from a common pluripotent hematopoietic stem cell. That stem cell may differentiate into a lymphoid stem cell, which then differentiates into a white blood cell called a lymphocyte. The pluripotent hematopoietic stem cell may also differentiate into a myeloid stem cell, and that stem cell can differentiate into all of the other leukocytes, an erythrocyte, or a megakaryocyte. Despite the fact that erythrocytes outnumber leukocytes by 1,000 to 1, only 25% of the bone marrow is composed of developing red cells, and 75% consists of developing white cells. And this is because white blood cells have such a short lifespan. Hematopoiesis occurs in the liver and spleen of the embryo and early developing fetus. However, hematopoiesis gradually shifts to the red bone marrow such that at the time of birthing, all hematopoiesis occurs in the red bone marrow. However, the liver and spleen retain their ability to produce blood cells, and even in adults, under certain conditions, the liver and spleen can resume production of blood cells. Now let's talk specifically about leukocytes, or white blood cells. Leukopoiesis is the production of white blood cells specifically. A cytokine is a substance produced by a cell that has effects on nearby cells and sometimes on cells far away. Cytokines released by leukocytes stimulate leukopoiesis. Leukocytes are illustrated in this blood smear here. They're stained in dark purple. Leukocytes are the only blood cell that are complete cells with a nucleus and organelles as adult cells. The function of leukocytes is to defend the body against infections and airborne particles that can enter the lungs, newly formed tumor cells, as well as to remove dead cells, remnants of dead cells, and to assist with the repair of damaged tissue. Leukocytes are mobile cells. They exhibit an amoeboid-like movement that is referred to as diapedesis. In fact, leukocytes can squeeze between cells that make up the walls of capillaries, allowing them to leave the blood vessels and enter the surrounding tissue, where they can destroy foreign particles or cells or help in the repair of damaged tissue. Now let's talk about each of the leukocytes, and I want to stress that I want you to know the most basic description of each of these leukocytes. We're not going to go into great detail about them. You will learn more about them when you complete your take-home exam, which will include the chapter on the lymphatic system. The lymphatic system will go into greater detail about these leukocytes. I just want you to have a basic idea of the functions of these cells. These 3 cells here are often referred to as granulocytes because the lysosomes within these cells take up stain very well and they appear as little granules. Also, they all contain lobed nuclei, as you can see. I often refer to the granulocytes as the phils because they all end in PHIL. You have the neutrophils, the basophils, and the eosinophils. So now let's talk about each of these granulocytes. The first granulocyte I'd like to discuss are the neutrophils. The neutrophils are the most abundant white blood cell in the body. They are phagocytes. They phagocytize and digest bacteria, particulates, and other foreign bodies. The figure on the right illustrates how a neutrophil might detect, engulf, and digest a foreign particle. Neutrophils play a very important role in responding to acute or short-term infections. Neutrophils have the shortest lifespan of all leukocytes, only living a few hours. The eosinophils are a second type of granulocyte. They are much less numerous than the neutrophils. Eosinophils multiply as part of an allergic reaction, and they also will multiply in response to invasion of the body by multicellular organisms such as parasitic worms. Eosinophils secrete enzymes which kill multicellular organisms or neutralize allergens. Allergens are substances which cause allergic reactions. The least abundant of all the granulocytes are the basophils. Basophils release a substance called histamine, which dilates blood vessels. They also release heparin, which is an anticoagulant, preventing blood from clotting. And basophils release other substances which attract eosinophils to the area. By releasing these substances, basophils help support an inflammatory response to injury or infection. Now let's talk about the agranulocytes. This includes monocytes and lymphocytes. They're called agranulocytes because they don't have the visible granules that the granulocytes had. Notice that one of these agranulocytes, the monocyte, is derived from the same myeloid stem cells that the granulocytes were derived from. The lymphocyte, however, is derived from a different stem cell, the lymphoid stem cell. Lymphocytes are found mainly in lymphatic tissues such as the lymph nodes and the spleen. You will also find lymphocytes in the bone marrow. Lymphocytes are not phagocytic cells, and they move much more slowly than granulocytes. Lymphocytes play very important roles in an immune response to infection. If you've ever heard of a B or T cell, those cells are lymphocytes. Monocytes are the largest of the white blood cells. They are transported throughout the body by the bloodstream. They then leave the bloodstream and migrate to different parts of the body where they become very highly mobile and highly aggressive phagocytes called macrophages. Macrophages play a key role in fighting chronic infections along with the lymphocytes. There is a normal range for leukocytes in the blood, and they're between 4,000 and 11,000 cells per milliliter of whole blood. Now, I will not ask you to remember those numbers. I simply wanted to share them with you and let you know that there is a normal range for leukocytes in the blood. When leukocyte levels get above 11,000 cells per milliliter, an individual is said to have leukocytosis. This usually indicates an infection where the body is responding to the infection by producing larger numbers of white blood cells. Leukopenia is an abnormally low leukocyte level. Several drugs can interfere with the production of white blood cells and cause leukopenia. Also, certain steroids can also interfere with white blood cell production and depress leukocyte levels in the blood. The corticosteroids are steroids that are produced by the adrenal cortex when one is under long-term stress. You probably have heard someone say that stress can cause you to get sick. Well, there actually is a physiological basis for that. If you are stressed for a long period of time and you are producing corticosteroids for a long period of time, this can actually reduce the production of white blood cells, making you more susceptible to infection and therefore illness. Leukemia is cancer of the bone marrow, which results in large numbers of immature leukocytes being produced. One of the telltale signs of leukemia is a much larger than normal buffy coat. These immature leukocytes are not capable of their normal protective function. Therefore, the individual is susceptible to infection and disease from bacteria and viruses that the body would normally have no trouble fighting off. Also, the large amount of leukocytes in the blood can crowd out red blood cells, possibly leading to anemia and a lower oxygen carrying capacity of the patient's blood. Now let's review the objectives of the screencast. Describe hematopoiesis. Define leukopoiesis. Explain the general characteristics and functions of leukocytes. Define diapedesis. Describe each of the 5 leukocytes. Define leukopenia and leukocytosis and list their causes. And lastly, describe leukemia. The next screencast will cover the topic of platelets and hemostasis.